In the last 24 hours, we saw the rise of numbers, passing almost 20,000. We are sitting at 21,584 new cases, and also which is higher than average number of new cases per day over the 7-day preceding that we have seen. The positivity testing rate has also increased from 27 to 28.4% in the last 24 hours. This shows increasing number in many provinces across actually, but Gauteng continues to be the epicenter of the new infections, with the number of new cases having risen to 12,806 last night, which represents 60% of the total number of new infections, but also a food positivity rate of 37%. We remain very worried about the increased number in hospitalization, which is putting a lot of strain in the health facilities in Gauteng. The trends are clearly showing that other provinces which are currently lagging are going to experience almost the same trend we are seeing in Gauteng, most notably in the Western Cape when we look at last night number and the Northwest, due to increasing numbers. But what worries as well is the positivity rate. If you look how Limpopo has almost 42% of positivity rate, which is leading in terms of positivity rate. We are also paying attention to what is happening in the Eastern Cape and as well as KwaZulu-Natal. So many provinces, we can say that almost at red alert for us, looking at the numbers and how the pandemic is performing. We had the Alpha that drove the first wave. We had the Beta that drove the second wave. Now Delta is driving the third wave in terms of domination of the numbers that we see in terms of the variant that is present. Other important characteristics of the Delta variant is that the fact that whereas with those who were previously infected by Beta variant, or during the Beta, as Beta was dominating in the second wave, were immune from reinfection by both the Alpha and Beta variant. It is not the case with the Delta variant now. This means that those who have had COVID-19 are also at risk of reinfection by the Delta variant.